Assalamu alaikum, beta. In this video lecture, I will deliver the lecture on uh, malignant tumors of the skin, the squamous cell carcinoma. Okay, and I will be recording the basal cell carcinoma in the next video lecture. Right? Squamous cell carcinoma is a malignant condition of the skin, and by the way, it is the second most common tumor. The first most common malignancy of the skin is BCC, that is basal cell carcinoma. Okay, and this squamous cell carcinoma arises on the sun exposed skin and especially in the older individuals. Okay, yeah. Number 2 point is, except for lesions on lower legs, these tumors have higher incidence in men than in women. Okay, legs को छोड़ के, lower legs को छोड़ के, ये जो squamous cell carcinoma है, इनका incidence men में बहुत ज़्यादा है. Okay, yeah. And these squamous cell carcinoma, they less than 5% metastasize to regional lymph nodes. Okay, these lesions are deeply invasive and involve the subcutaneous tissue. So if I this is the epidermis, let's suppose. So I must tell you beta that squamous cell carcinoma is very much invasive. It gets deeper and down into subcutaneous tissue rather than getting out into the lymph nodes. Okay, they do metastasize to lymph nodes, but only less than 5%. The thing they love to do is they get down, they are very much invasive, and try to involve dermis and deeper down into the subcutaneous tissue. Okay, let me now quickly tell you beta some risk factors of the squamous cell carcinoma, that why do people develop squamous cell carcinoma, what are the risk factors. Number one thing, which I was, I told you in the previous lecture of the actinic keratosis as well, that chronic exposure to UV light in the sun rays. Okay, tumor incidence is directly proportional to degree of lifetime sun exposure. The greater you are exposed to sunlight, the greater you are at risk to develop the squamous cell carcinoma. Okay, and some other risk factors like chronic immunosuppression, that may be due to HIV infection, maybe due to chemotherapy, maybe due to organ transplant. Okay, so if you are chronically immunosuppressed, so you can develop a squamous cell carcinoma. Why? What happens with immunosuppression? The host surveillance is reduced, obviously, and very important thing, that if you are immunosuppressed chronically, you can develop the infection of the skin keratinocytes by oncogenic viruses, human papilloma virus 5 or 8. Okay, so if you are immunosuppressed, you can develop the infection of this oncogenic viruses. So once your keratinocytes are infected with this oncogenic viruses, you are for sure going to develop the squamous cell carcinoma. Okay, by the way, these oncogenic viruses, human papilloma virus 5, 8, they are also responsible for squamous cell carcinoma arising in patients with rare autosomal recessive condition, that is epidermodysplasia verruciformis. Epidermodysplasia verruciformis is, by the way, an autosomal recessive condition. In this condition, patients do develop squamous cell carcinoma. And what is the cause behind that? The same virus. Okay, human papilloma virus 5 or 8. So two main risk factors: chronic exposure to sunlight and chronic immunosuppression. Yeah, these two can lead to development of squamous cell carcinoma. Okay, what else? What are some other risk factors that can participate? They are like, okay, खास करके oral cavity में अगर squamous cell carcinoma होता है तो उसका reason tobacco smoking और ज़्यादा betel nuts, छालिया वगैरह खाना. So they can cause, they can irritate your oral mucosa, leading to development of squamous cell carcinoma. Arsenicals का exposure, ठीक है, draining osteomyelitis can be a very good risk factor for the development of squamous cell carcinoma on the skin. Okay, why draining osteomyelitis? Osteomyelitis is the infection and inflammation of bone and bone marrow. But let me tell you bit quickly that if, let's suppose, this is your bone and this is skin over the bone, and this is the infection of the osteomyelitis. But what happens in chronic osteomyelitis, that chronic osteomyelitis drains onto the skin, just like this. This is the bone infected by osteomyelitis, and in chronic cases, some draining sinuses are formed like this, which open onto the skin. You know what? In chronic osteomyelitis, what happens beta? This infection opens, from bone onto the skin by these draining sinuses. So squamous cell carcinoma can arise from the epithelium of these draining sinuses. Okay, so remember, this is a very good important point, that draining osteomyelitis can also be a very important risk factor for the development of skin squamous cell carcinoma. Chronic ulcers of the skin, okay, and industrial carcinogens like some tars, some oils and tars, and old burn scars of your skin. If you have old scars of burn on your skin, do treat them, otherwise they are going to develop into squamous cell carcinoma. And ionizing radiations as well, beta, right? These are some risk factors of squamous cell carcinoma. Now let me quickly tell you that what is the pathogenesis of squamous cell carcinoma, right? Okay, beta, before I quickly tell you what is the pathogenesis of squamous cell carcinoma, you first need to understand what is happening normally. Normally, what happens in normal individuals, when you are exposed to UV radiations in the sunlight, there is damage, DNA damage in skin cells. Obviously, you and I, beta, we wake up early in the morning. You go to your colleges. You go to your workplace. You are exposed to sunlight every time. By the way, so every day your DNA is damaged in the skin. But remember, that DNA damage in your skin is quickly sensed by some checkpoint kinases. Checkpoint kinases like ATM, ATR. And what do these ATM, ATR do? They upregulate the expression and stability of P53. And what does this P53 do? These P53 arrest the cell in G1 phase and promote the DNA repair or apoptosis of completely damaged cell. अगर आपके स्किन सेल का बेटा डीएनए डैमेज हो जाता है, जो कि होता रहता है सन एक्सपोजर की वजह से, तो एटीएम और एटीआर उसको क्विकली सेंस करते हैं और P53 को एक्टिवेट कर देते हैं। फिर P53 क्या करता है कि ऐसे डैमेज्ड डीएनए वाले सेल्स जो हैं, उनकी जो सेल साइकिल है उसको G1 फेस में रोक देता है और उनके डीएनए को रिपेयर कर देता है। और अगर डीएनए रिपेयरेबल ना हो तो उस सेल की एपोप्टोसिस करवा देता है, ताकि वो जो डीएनए चेंजेस हैं, डीएनए डैमेजेस हैं, जो डीएनए म्यूटेशंस हैं, वो आगे ना इंक्रीज हो, ना आगे वो ना मतलब दूसरे सेल्स में पास ना हो। ठीक है, लेकिन व्हाट हैपन्स इन केस ऑफ स्क्वामस सेल कार्सिनोमा? What happens in squamous cell carcinoma? Due to very much increased exposure to UV light in the sun, repeated exposure to chronic exposure to sunlight, the P53 activity is lost. P53 is activity is lost. And you remember, na beta, what was P53 doing? What was P53 doing? It was arresting the cells in the G1 phase. If a cell is having damaged DNA, then what was this P53 doing? If a DNA damaged cell was there, what P53 was doing? It was trying to stop the cell cycle of that cell and then repairing its DNA. And if it is not repairable, the cell was then killed, apoptosized. Okay. But when you are chronically exposed to sunlight, and now I'm talking about squamous cell carcinoma, when you are chronically exposed to sunlight, this P53 activity is lost. Then DNA damaged by UV light is more likely to be repaired by error-prone mechanism. Now, because you do not have P53, so there is no accurate mechanism to repair the DNA. However, it is going to be repaired by some abnormal mechanism, that is error-prone mechanism, that will further create the mutations that will be passed down to daughter cells. Okay, and this will lead to the development of squamous cell carcinoma. Okay, main mutations are, by the way, in the P53, but there may be some other mutations other than P53 that may also contribute. They include mutations in the RAS signaling pathway, that is gain of function mutation, increased mutation in the RAS signaling pathway, and loss of function mutation in the Notch signaling pathway. Okay, yeah. One more thing I need to mention in the pathogenesis part, beta, is that xeroderma pigmentosum is the skin condition that can develop into squamous cell carcinoma, because xeroderma pigmentosum is having same kind of inherited mutations which we just discussed. So in xeroderma pigmentosum, people also kind of, they do have defects in the DNA repair pathway, so it may develop into squamous cell carcinoma. Okay, this is the pathogenesis of squamous cell carcinoma, beta. Now I will now tell you the morphological features of squamous cell carcinoma. Yeah, so beta, morphological features of squamous cell carcinoma, I need to tell you a couple of things here. If let's suppose this is your epidermis, okay, and if let's suppose this is the basement membrane, right, and below basement membrane is this structure called dermis. Okay, if the squamous cell carcinoma is restricted to basement membrane, if it is restricted to basement membrane, it is called in situ carcinoma. Okay, but okay, when it is restricted to basement membrane, it is called in situ carcinoma. And in this case, how does it appear on the skin when it is restricted to basement membrane? It appears as a sharply defined red scaling plaque, just like this. Let me quickly show you. Isn't it? Yeah, can you see? Can you see beta? This is sharply defined red scaly plaque. Okay, and this is the case of in situ carcinoma, in situ squamous cell carcinoma. Okay, but if this carcinoma extends down into dermis, if it invades down into the dermis, it is not called in situ carcinoma anymore. It is now called as invasive carcinoma when it has invaded into the dermis. Okay, and by that time, when it has invaded into the dermis, how does it appears on the skin then? Okay, again, this is when it was carcinoma in situ. Okay, when it was restricted to basement membrane, but when it has invaded into the dermis, then its appearance become a little bit different, just like this. Can you see? This is the invasive carcinoma of the skin. It is now not anymore, kind of small nodule. It has become very much, kind of large nodule. And can you see, this is hyperkeratosis. This white hyperkeratosis is white hyperkeratotic scale. This is due to increased keratin production, and this is very much ulcerative. It ulcerates down into the skin. Okay, so ulcerative. Yeah, can you now see the difference? Can you now see the difference? This is when the squamous cell carcinoma is restricted to basement membrane, when it is in situ carcinoma. Okay, and this is the invasive carcinoma. Okay, can you see the clear difference between these two? This is invasive squamous cell carcinoma, and this is in situ carcinoma. Okay, and unlike actinic keratosis, beta, in case of squamous cell carcinoma, the atypical cells are present in all the layers of epidermis. In the previous video lecture on actinic keratosis, I told you that the atypical cells are only present at the basal layer. That is the lowest most layer of the epidermis. But in case of squamous cell carcinoma, you will see the atypical cells are present throughout all the layers of epidermis. Can you see? These all are atypical cells. These all are, atypical cells with atypical atypia, cytologic atypia down, from here all the ways down. Okay, this is the cytologic atypia. The atypical cells are present throughout the thickness of the epidermis. Okay, and in case of actinic keratosis, it was not like that. The cytologic atypia was present just like here at the lowermost layer. Right. One more thing beta I have to add in this squamous cell carcinoma, and that thing is that invasive squamous cell carcinoma, not in situ, invasive squamous cell carcinoma, it show variable degree of differentiation. Okay, the invasive squamous cell carcinoma may be like this, okay, or it may be like this. What is the difference between this and this? And what did I say beta? Invasive squamous cell carcinoma show a variable degree of differentiation. So it may be like this or maybe like this. So it may be like having polygonal cells and lots of keratinization and forming keratin pearls. Okay, तो एक तो कंडीशन ये हो सकती है कि ये बहुत ज़्यादा पॉलीगोनल सेल्स हों और केराटिनाइजेशन ज़्यादा हो और केराटिन पर्ल्स बनाए. ठीक है, केराटिन के गोल पल्स आई विल शो यू। या फिर ये ऐसा हो सकता है इन्वेजिव कार्सिनोमा के इसके सेल्स बहुत एनाप्लास्टिक हों और उनमें सिंगल सेल केराटिनाइजेशन हो, डिसकेराटोसिस हो, इंटायर केराटिनाइजेशन नहीं हो पूरी एपिडर्मिस में, सिंगल सेल केराटिनाइजेशन हो और केराटिन पल्स नहीं बनाए। सो एक कंडीशन ये हो सकती है इन्वेजिव स्क्वामस सेल कार्सिनोमा में कि पॉलीगोनल सेल्स हों, केराटिनाइजेशन बहुत ज़्यादा हो और केराटिन पल्स बने। और दूसरी कंडीशन ये हो सकती है कि या तो एनाप्लास्टिक सेल्स हों और डिसकेराटोसिस हो, यानी कि सिंगल सेल तक केराटिनाइजेशन हो और केराटिन पल्स ना बने। ठीक है, लेट मी क्विकली शो यू द केराटिन पल्स विच आर फॉर्म्ड mostly squamous cell carcinoma show this condition, okay, in which you will see these are the pearls of the keratin, okay, which are showed in this condition, in which there is keratinization in the entire thickness. Can you see few more keratin pearls? Can you see beta? If I just further zoom it in, can you see these keratin pearls? Yeah, these are the keratin pearls. So this is it beta, this is it. That's all about the squamous cell carcinoma of the skin. And beta, I must mention it again that entire lecture, every word in this lecture is from your textbook of your pathology, that is Robbins basis. Okay, that's all about today's lecture. That's it. If you have any question, you can ask me anytime, anywhere. Thank you so much beta. If you really like it, you can appreciate me by liking the video, subscribing to the channel. Class dismissed.